In this demonstration, we're going to be talking about the muscles of facial expression. And these muscles are very thin, very pale, and they lie sort of within the connective tissue plane of the face and of the neck. They actually originate on the underlying bones and insert onto the skin so they can produce a lot of diverse movements, which are really important for nonverbal communication. So as always, I like to start superiorly and work my way inferiorly. So overlying our frontal bone here, we can see a portion of the Occipital Frontalis, and it's going to have a belly on the frontal bone, as well as a belly on the occipital, which we can only see a small portion of on this model here. And then it's going to have a dense aponeurotic sheath that connects those two. Our Occipital Frontalis allows us to lift our eyebrows, like so. We have two circular muscles that are going to be involved in opening, closing our eye and our mouth. And these are our Orbicularis muscles. So Orbicularis oculi surrounds the eye and again is involved in primarily closing of the eye. We have some assistance from the Levator palpebrae superioris to open the eyelid. Okay? And again, these muscle fibers are really thin. They can be tricky to see in dissection. I'll show you on a plastinated specimen afterwards, but it's really good idea to take a look at the model first to get oriented since they are so thin and can be tricky to see. Okay, the Orbicularis Oris is surrounding the mouth, and again, it allows us to close our mouth as well as to sort of puff out our cheeks, like so. Okay. There's a few muscles that help to lift the corners of our upper lip or elevate the upper lip, and these are Levator Labii superioris, sort of to do this kind of like snarling motion, and our zygomaticus major and minor, which help to lift the corners of the mouth. You'll also notice a very superficial muscle that's inserting here over sort of the mandible, the skin of the mandible, and this is called the platysma. It actually has a really broad origin, sort of off like the fascia associated with our pectoralis major and deltoid, and then travels superiorly and overlies sort of that lower mandible. And it's sort of really thin and stringy. And if you sort of like clench your teeth and go like that, you can feel that and see that visibly on yourself. Okay. So those are just a handful of ones that you'll commonly see, again, in your plastinated specimens or in dissection. So let's quickly go through the ones that we can appreciate on our plastinated, sagittally sectioned head model. Okay. So again, starting from the superior aspect, we'll have our Occipital Frontalis, okay? That's the frontal portion. Surrounding the eye, the Orbicularis oculi. Okay. Surrounding our mouth, the Orbicularis Oris, okay? Levator Labii superioris is sort of cut, a little tricky to see, as well as our zygomaticus major and minor muscles that again would lift the corner of the mouth, okay? We can see some of the fibers associated with platysma here as well, right? So revisiting our Occipital Frontalis, I wanted to talk a little bit about the layers of the scalp because scalp is actually an acronym, which I think is pretty fun, okay? So starting from superficial and going deep, the first layer, or S, is going to be representative of the skin. Then we're going to have a dense connective tissue, okay? Then we're going to have the aponeurosis of our Occipital Frontalis. L represents a loose connective tissue. So you know how you can sort of like move your scalp on your skull. That's due to the loose connective tissue. And then lastly, the P is for periosteum, which is a thin, vascularized soft tissue layer associated with the outer cortex of your bones.